Hi everyone, my name is Yisha. I select Health Information Technology. It's a chronic disease management network. The Chronic Disease Management Network is an online web-based server designed to provide effective, systematic, and long-term care for a large amount of chronically ill patients. The Chronic Disease Management Network helps GPs, practice nurses, and the community to build a registry of patients with chronic disease, to create individual-based practice plan, to share the care plan and health record across the care team and with the patients, to produce and distribute all documentation, to provide patients reminders and supports, to collaborate with one another, to monitor progress against the care plan, to complete follow-up and review, to manage medicine compliance. So that's why I choose these technologies. The various of evolution of chronic disease management network are advanced information technology system, the representative application of IT healthcare, support the entire procedure of care from end to end. So finally, it's a set guideline for future applications. About the technical design, the chronic disease management network needs a broadband network to provide upfront information transmission and communication. The communication infrastructure is required to the patients. A laptop or handheld device, such as iPhone, iPad, is required with standard internet browsers, such as Internet Explorer 8, Safari, and Firefox. Using the handheld devices, the patients can access the patient can access chronic disease management network anywhere, anytime. To doctors or care team professionals, the chronic disease management net desktop software should be downloaded and installed in on a single computer, on a shared server, or in a terminal server mode, so that the doctors or care team professionals can use the chronic disease management net desktop software to check the care plan and provide the suggestion for the patients. The whole system is designed to include some independent units. The first is electronic health records. The second is e-referral. The third is messaging service. The fourth is hospital. Next, I will introduce some processes of the system. The first, the chronically ill patients need to register once on a website of a chronic disease management network. After they are identified the illness by the doctors, then the doctors update the data of the patients to the electronic health records. When the patient wants a care plan, The care team professional receive the request and then consult with doctor, nurse to create a suitable plan for the patients. After that, the patients will receive the confirmation letters to determine whether this credit plan is suitable or has some details to be changed. Finally, they will make a decision of a care plan and run this plan. When the plan starts, the doctors, nurses, care team professionals are easy to view the progress of the plan and the patient's health record after treatment. The system has a special ability. It's automate follow-up and review, which control the sequence of the plan, avoid repeatedly care plan to repeat on practice. The doctors, nurses, and care team professionals will give some advices of each step of the plan, so that the patient can do self-management through the mentioned advices. Each step of the plans for different patients has a corresponding drug treatment. To distinguish each step clearly, the system provides a medicine compliance management, so that it's easily to know each which this step to use which drug. As a whole, the chronic disease management networks have some characteristics. The first is the automation. The second is connectivity. The third is decision-making support. The fourth is recognize new relationships in data. About the automation, what means the patients or the doctor, nurse, or the care team professionals update data, and the basic servers will receive the data and send to the patient or doctor, nurse, professional care team professionals. About the connectivity, we know I have mentioned this system includes some units such as health hospital, county information management department. This system combine of this unit to present these characteristics connectivity. About the decision making support, the doctors, nurses, the care team professionals will get the record after the treatment. So they may change the plan to provide a good plan for the patients. So this is decision making support. About the last, recognize new relationships in data. If a new department want to join these systems, so this department has its function, and this system is easier to know and to connect this department to others. The The character disease management networks have some benefits. The first is save time. The second is eliminate paperwork. The third is simplifies collaboration. The fourth is improvement outcomes. The fifth is increase net revenues. The sixth is reduce risk. The seventh is maximum flexibility. The chronic disease management networks is used widely and is suitable for many diseases such as diabetes, stroke, chronic heart failure, chronic low back pain, and so on. After this system is implemented, most people will choose the chronic disease management net to get a professional health care, and the care plan is shared global. So other states may know the new plan to treat the chronic disease. About the better coordination, it said just the chronically ill patients need to register once and enter some details of their health, so the system will get a corresponding plan to treat them. The second is the security of a patient's privacy. This is the most important after the system is completed. The chronic disease system is a high quality information and consultation between primary and community care agencies and acute health provider. The system may widely implemented in GPs. I list one recommendation is the government should have a certification role in ensure that people on low incomes and those with special needs have access to service. Okay, that's all. Thanks.